Good morning, everyone. My name is Jason Perry, and I am the National Sales and Marketing Director here at MAS. I'd like to introduce you to MAS. We are a nationally recognized, award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama, just outside of Birmingham, where we were 24 degrees this morning and should be almost 70 degrees by the afternoon. So I hope you're going to get a little great weather yourself. We're excited to share with you that MAS became a partner of Integrity Marketing Group in October 2019. We've had a long-standing relationship with Integrity Marketing Group over the years, so it was a natural alignment for us to become a platform partner. Through this, MAS will be able to bring more products, more tools, and more resources to our broker distribution. We're truly honored to be working alongside our other partners in the industry. So we are innovating insurance. We're leading the way in InsurTech. So Integrity isn't just on the cutting edge of insurance technology, we're really leading the way. Developed by world-class experts, our proprietary tools, resources, and exclusive services help us customize the insurance experience so consumers can find the right coverage and be prepared for the good days ahead. At MAS, we are proud of the superior support, service, and training we provide to the agents across the country who work with us. We take great pride in our relationships with our agents and carriers. Our staff provides marketing strategies and assistance, creating numerous opportunities for our agents through lead programs, our Turning 65 platform, the Agency Builder program, Fast Start programs, and many other initiatives. MAS marketing managers are eager to work with producers to help you grow your business, and we can provide a market analysis of products available in your area to assist you in developing a strategic marketing plan for your business. We're always up to date on the latest products, carriers, lead programs, and services as they become available. Of course, we're always available to provide both back office and field support, making it easier for you to concentrate on sales growth. So our goal is to help you grow your business. Our specialty is the senior market, and our carrier portfolio is supported by Medicare Supplements, Medicare Advantage, Final Expense, Whole Life, Term Life, Universal Life, Critical Illness, Cancer, Dental, and Annuity. These are a few of our portfolio of carriers, a few displayed here, so there are others, plenty to choose from. So one of our exclusive lead programs is in front of you. So direct agents with 3 or more active carriers receive a discount on their first lead mailing. Our co-op program is available for consistently producing agents. So you get a 25% discount on a mailing after 7 issued apps in a month, 50% discount on a mailing after 12 issued apps in a month, and 100% discount on mailing after 20 issued apps in a month. And the lead co-op is available to agencies with a downline hierarchy as well. So we do have cost sharing opportunities there. So reach out and talk to us about that. We'll be happy to go over that with you. So check out the new Medicare Center. It's a one-stop shop for everything you need to successfully navigate the sales and enrollment process. You can now experience the Medicare Center with the full power of CSG's resources, which it has e-apps, data analysis, quoting tools, competitive analysis, heat maps, and an exclusive website plugin to capture MedSup leads. And it's available to our contracted agents at no cost. So we can actually plug in a tool that generates leads directly to you. So reach out to us if you have a question about that. If you've got a website, you drive your clients to that website. Awesome tool, all at no cost to you. This tool puts you on the cutting edge of technology, offering you the ability to run quotes for Medicare Supplements, run quotes for, Medicare Advantage, compare products against each other. You can even download current applications and outlines of coverage for your desired plans. You can email applications and outline of coverages directly to your clients. And there's 2 options for enrollment. There's an email process that you can use, or there's actually a text to enroll option. So really great stuff. All agents who wish to use the tool need to register for a username and password on our website, and you must be contracted with us for select Medicare products. This one's really great. The T65 Locator makes it easy for you to find local Medicare prospects. It's quick to use. Pulling up locations on this map is a breeze. The best part, it's free for agents who do business with Medicare Advantage specialists. Imagine being in the field, you don't have a lead, you want to sell some Medicare supplements. You can tap the top blue bar. It says T65 Locator, and then a map pops up. And well, you can actually set the distance, but 5, 10, 25, or 50-mile radius, all these little red dots pop up. And if you touch one of those red dots, it tells you how long they're going to be before they're 65. It tells you their name, and it tells you their birthday, and it tells you their address. So you just basically never have to buy leads again. This is a great tool, and it is free to those agents that work with Medicare Advantage specialists. So we all know that growing your business is only going to happen if you develop a winning strategy. Consistently put in the work and utilize smart tools and platforms that make it easier for you to deliver your expertise to the right clients. That's why we developed a Turning 65 workshop platform. We assist our agents in identifying target markets for the Turning 65 population. So we created a process that's so simple for agents to follow that we now have many, many agents nationwide hosting weekly and monthly meetings, creating a tremendous stream of lead generation. If you'd like to talk more about this program, talk with one of our marketing managers today. So those of you that are interested in building an agency, let us help build your agency. So recruitment lists are provided along with the auto dialer capabilities. We have specialized call campaigns created just for you, and co-op opportunities are available for the lead programs. Here's our new agent Fast Start bonus for new agents. You get a $25 gift card for the first issued app, only one. $75 gift card with 4 or more applications issued in the same month. And then we also offer a $50 gift card when a referred agent writes their first app. So that's direct to MAS only agents. But remember, this does not apply to Medicare Advantage or dental production. So why choose Medicare Advantage specialists? Because prospecting can be a challenge, and we're here helping you arm in arm with the tools necessary to help you be successful. We understand that our long-term success will define itself based on your success as an agent or as a carrier. Medicare Advantage Specialist is committing to exceeding our clients' expectations in every interaction and helping you achieve that same level of service with your customers. Agent support is our primary goal. We provide every tool we can to identify, to assist you in your efforts to identify, inform, choose, and close, and follow your sales process. In practical terms, our marketing team works arm in arm with you to deliver print media, internet, direct mail, and other marketing tools, keeping your pipeline moving. We have one of the most experienced support teams in our industry. When you work with us, you don't need to buy T65 lists anymore. Plus, you'll have access to the Medicare Center, free marketing customization, our quoting tools, and really so much more. So here's how you can contact us today to discuss any of the topics we just reviewed. It's 800-480-9857. You can also visit us at our website at MedicareAdvantageSpecialist.com. There's multiple ways to contact us for specific products. We're in general on that website. But please feel free to give us a call today, and we're happy to help you. So let's get to today's webinar topic. Today we have with us Rebecca Mess, which is the Regional Sales Director for AARP Medicare Supplement Insurance Plans from United Healthcare. And I will go ahead and give you control, Rebecca. Let's see if we can do this. And you just let me know if it works and we can see you.
All right, I think I have it up there. You can see my screen, Jason?
Yes, we can.
Awesome. All right. Thanks so much. And I loved hearing the introduction about Medicare Advantage specialists, but I will have to say we have kind of the same swing in weather here in Pennsylvania, where over the weekend it was 60 on Saturday, and then we woke up on Sunday to like 2 or 3 inches of snow on the ground. Wasn't expecting that, and but I guess this time of year it's just, it is what it is. I always wanted to live in an area that had, the change of seasons. I just wish that winter was a wee bit shorter. A little bit more sunshine, a little bit more summer would be great. I do hope that everybody had a wonderful Valentine's Day yesterday. Today is actually another special day for me. My oldest son turns 19, so we were able to celebrate both Valentine's Day and his birthday over the weekend since he's away at school. But definitely an exciting week, and really appreciate you, Jason, and the Medicare Advantage Specialist team for allowing me to be here to share some information on Medicare Supplement, specifically the AARP Medicare Supplement plans. MedSup, of course, is a great year-round selling opportunity and another way to, diversify your book of business. And as Jason was mentioning, having some of that residual income with some of these plans on your book. So without further ado, I'm going to go ahead and jump over to the agenda. We do have kind of a packed agenda here. We're going to start out on the basics of Medicare, including the difference between Medicare Advantage and Medicare Supplements, and as well as the different opportunities to enroll in a Medicare Supplement plan. And then we'll talk a little bit about why AARP Medicare Supplement is different. As you know, Medicare Supplement plans are a commoditized product, but it's more than just looking for the lowest premium when you're selling a Medicare Supplement. So what are some of the other factors that you want to look for when you're going to work with a carrier and enroll your clients in a Medicare Supplement? And then part of our differentiation is our value-added services. So I'll cover a little bit more on those value-added services and what's available to members once they enroll. We do have plenty of branded marketing pieces and improved social media posts. So we'll talk a little bit about our marketing and what's available in Toolkit. And then we're going to wrap up with some reminders. All right, so talking about Medicare basics, we know that original Medicare doesn't cover everything. Fortunately, though, there are options for Medicare beneficiaries. Consumers can elect a Medicare Supplement with a Part D plan, or option 2 is they can choose a Medicare Advantage, where Medicare benefits are administered by a private company, and many times are going to include the Part D coverage packaged in with that plan. A lot of the ways I look at the differences between Medicare Supplement and Medicare Advantage. Medicare Supplement is kind of pay as you know with the premiums, where Medicare Advantage is pay as you go, typically with copays and deductibles. Many plans obviously have a very low premium to no premiums that are associated with the Medicare Advantage plan. Another fundamental difference is that a Medicare Supplement plan is not network-based, where a Medicare Advantage is network-based. MedSup is going to pay secondary to Medicare, which is also an important distinction. And then Medicare Advantage has to cover at a minimum what Medicare covers, since they take over the administration of those benefits. But in most cases, they're going to cover additional benefits above and beyond what Medicare covers. Those services can be anywhere from vision and hearing benefits, over-the-counter drug cards, and even meals or transportation, depending on the plan. So again, 2 fantastic options for seniors to be able to get additional coverage and have that peace of mind that their medical coverage is going to cover them. I do see, it's funny, debates all the time online about how maybe one product, Medicare Supplement or Medicare Advantage, is better than the other. But truly, the answer is both are great options. And it's going to depend on the client and what their needs are. If you have a client that's talking about wanting to be able to travel throughout the United States, or they don't want to be tied to a network or have maybe the benefits of guaranteed coverage for life, then a Medicare Supplement plan might be the right fit for them. With a Medicare Supplement, you can see any doctor or hospital that accepts Medicare. And in some markets, that can be a huge concern when a major hospital or maybe a specialist isn't in the network. And another thing I always like to mention too is that, keep in mind needs can change over time. So they might not be concerned about a hospital being in the network, or maybe, a cardiovascular surgeon or whoever, the specialist is that isn't in the network now. But unfortunately, we don't have that crystal ball to know, when we might need that coverage and be able to access those physicians. So it is always nice to kind of plan ahead for that to make sure that you have the coverage that you need and want. Being able to budget medical expenses each month also provides that peace of mind. There isn't a wide fluctuation month to month as to what out-of-pocket costs are going to be for medical services. And that MedSup plan is going to provide the stability and benefits year to year. So the benefits don't change. They're standardized, and the only thing that's going to change year to year is the deductibles and coinsurance. And as those deductibles and coinsurance change through Medicare, the Medicare supplement plans are going to update the benefits based off of those new coinsurances and deductibles. So again, the best thing that you can do is diversify your book of business, and don't leave sales opportunities on the table by only offering one type of plan or another. Some basic enrollment guidelines. So the first one here is specific, of course, to the AARP Medicare supplement plans. And individuals that want to enroll in an AARP Medicare supplement plan, they have to be an AARP member or the spouse or partner of an AARP member that lives in the same household. So this isn't something that applies to our UnitedHealthcare Medicare Advantage or Part D plans. It is unique to the AARP Medicare supplement plans. And the reason for that is that our plans are individual plans, but they're issued on a group policy issued to AARP. So in order to be part of the group, you have to be a member of AARP. Now, if for some reason your client does not have an AARP membership, we have plenty of options to be able to enroll in the AARP membership. You can use Lean. There's actually a link right below the AARP membership field that takes you out to a tool that you can check enrollment or enroll them. There is a form in the kit that can be mailed back in with a check, or you can actually call into the toll-free number that we have and speak to somebody to enroll them over the phone. The nice thing is, too, the individual does not have to renew their AARP membership after they've enrolled. The only time that they might want to be a member, again, is if they are looking to plan change at a later date. So the other three guidelines are standard for Medicare supplement plans. You do have to have both Part A and Part B effective on their plan effective date. They have to reside in the state in which they're applying. So many states have different rules and requirements. So a lot of these states, individually, they cover, the Medicare supplement plans, whereas with Medicare Advantage, it's more of a federal program that covers all plans when it comes to the rules. But a lot of times Medicare supplement, there are specific state guidelines or state rules that are available to individuals or consumers. And then last but not least, they have to be 65 or older on their plan effective date. The only caveat to that is there are some states that require carriers to offer plans to under 65 individuals that are on disability. And so, just be aware that that might be available in your state as well. Typically, though, when they offer under 65 plans, not all plans are available to that individual. I want to talk just a little bit about the newly eligible versus previously eligible, because this will be important when we're looking at the plans as to what plans are available to consumers. So hopefully by now you've heard of MACRA. MACRA is the Medicare Access and Chip Reauthorization Act. It's a little bit of a mouthful there. But when that law was passed, it basically is limiting for newly eligible individuals plans C and F to be able to enroll in those plans. So somebody that is newly eligible is going to be someone that turned 65 on or after 1/1 of 2020, or their Part A effective date is on or after 1/1 of 2020. And then a previously eligible individual will be the opposite there. So they turned 65 before 1/1 of 2020, or they had a Part A effective date that was prior to 1/1 of 2020. That Part A effective date, the reason for that is we do have individuals that were on Medicare due to disability prior to 1/1 of 2020. And so even though those individuals might turn 65 later, after that 1/1 of 2020, they're actually still considered previously eligible because of their Part A effective date. So they are still able to purchase a Plan C or an F if they choose to do so, even if they haven't already in the past. So there are three opportunities to enroll in a Medicare supplement plan. One is open enrollment. The second is Guaranty Issue, which Guaranty Issue I kind of equate to loosely to in the Medicare Advantage world to be like an SEP almost. So you've got Open Enrollment, Guaranty Issue. Those two are without underwriting. And if you don't qualify for either of those two situations, then your client can actually go through underwriting. Not every opportunity to enroll is created equally, so it's really important to know the difference, especially between Open Enrollment and Guaranty Issue. So Open Enrollment is going to be the first 6 months somebody turns age 65 or older and they're enrolled in Part B. If for some reason someone delays their Part B, since maybe they're still covered under an employer plan or maybe their spouse's employer plan, then they would actually have 6 months from the Part B effective date once they enroll in Part B. So it's almost like a second opportunity to get that, that open enrollment. And this is really the ideal time to enroll in a Medicare supplement plan. And the reason for that is an insurer must offer all plans that it sells, including Plan G. So when we talk about Guaranty Issue, you'll see why that's important too. Again, there's no underwriting, of course, when you enroll during MedSup Open Enrollment. And then there's no pre-existing condition exclusions that are going to apply for the plans. And typically, a pre-existing condition is going to be something that a provider, a medical provider gave advice, they provided treatment or recommended treatment for, or they recommended or prescribed prescription drugs for. So just a quick example of the Medicare Supplement Open Enrollment period. So this is your basic open enrollment where Bob here, he actually has his 65th birthday on June 15th. So his Part B is going to start on June 1st. Therefore, he's going to have a 6-month open enrollment from June 1st all the way through November 30th. Now, with our plans, as long as we receive that application by November 30th, so in that 6-month window, they can actually request a plan effective date of December, January, or February, so up to 3 months out. In addition, individuals that are turning 65, they can submit their application up to 14 months in advance of their 65th birthday. Surprisingly, we get a lot of applications that come in pretty early. I'm always amazed at the people that can plan that far ahead. So I know when I get to this point, I feel like I'm going to be a last-minute person, but it is nice that they can go ahead and get that coverage in and not have to worry about it. And then this is an example of when an individual might have delayed their Part B effective date. So John is 70 and he's retiring at the end of June. So his Part B effective date is going to be July 1st, sorry. So he is actually going to have an open enrollment period from July 1st to December 31st. Again, the same situation where as long as we receive the application by December 31st, he can pick a plan effective date of January, February, or March, so up to 3 months out. All right, so let's talk a little bit about Guaranty Issue. So Guaranty Issue is going to be the set of rules or rights that provides Medicare consumers with access to coverage when they experience what is called a qualifying event. Probably the most common qualifying event is going to be losing or dropping employer coverage, kind of like in the example that we just discussed. Now, if that person, for some reason, took out Part A and Part B, as soon as they became eligible, then they would be dropping their employer coverage and they wouldn't have open enrollment, but they would have Guaranty Issue. Some other situations are when a consumer moves out of a Medicare Advantage service area, or maybe the trial rights where somebody tried Medicare Advantage for the first time, or maybe they dropped a MedSup to try Medicare Advantage for the first time. There's typically 6 standard qualifying events, but some states actually provide additional qualifying events, like loss of Medicaid coverage, but it really depends on the state. And then once again, you can't be denied or rated up based off of your health status, so there's no underwriting. There's also no pre-existing condition exclusions that are going to apply. But the big difference here is that carriers don't have to offer all plans. So this is kind of a big deal, especially for the previously eligible individuals, because they might want Plan G, but Plan G is not a Guaranty Issue plan. So the plans that would be available to somebody that's previously eligible as Guaranty Issue are going to be A, B, C, F, K, L, and N with United Healthcare. So you can see C and F are still available to them, and those are the Guaranty Issue plans. Now, if somebody is newly eligible, then they can get Plan G because they don't have Plan C and F available, so they can get A, B, G, K, L, and N. Now, N is also typically not a guarantee issue plan, but at United Healthcare, we do still allow that plan to be available to previously eligible individuals as guarantee issue. All right, so we mentioned the 3 different ways that you can enroll, and of course, if they don't qualify for open enrollment, they don't qualify for guarantee issue, then their last opportunity to qualify for a plan is going to be through underwriting. Each state is, again, kind of different. Some are underwritten to determine eligibility and accept deny, while others are underwritten for eligibility and to determine rate. And of course, underwritten business is an important part of our enrollments, and we have invested a lot of time in our underwriting process to improve that turnaround time and ensure a more favorable experience for agents and consumers. All right, so that was kind of a summary of the Medicare supplement basics, but let's talk about why you should have AARP Medicare supplement plans as part of your offering when you're working with your clients. So brand is an important part of our value prop, and I would say one of the reasons that AARP has trusted us with their brand is because of our experience in healthcare and the Medicare markets for over 40 years. Another reason AARP chose United Healthcare is our national presence. Our plans are available in all 50 states and the U.S. territories. Our contract with AARP actually began in 1997, and we've had multiple renewals throughout the years, and we're contracted now with them through 2025, which is hard to believe, coming up really soon here. But there's an easy option to renew through 2030. So again, it's a long-standing relationship with AARP. What this means for you as the agent is that there's a built-in market for agents with access to over 38 million AARP members. So these members that are part of AARP, they already have an affinity for the brand. And although we fluctuate over time, United Healthcare is currently number 5 in the Fortune 500. I've seen us go up and I've seen us go down, but we've always been at least in that Fortune, top 10 in the Fortune 500. And lastly, we're the only carrier to offer Medicare plans with the AARP name. So that includes not only the Medicare supplement, but also the Medicare Advantage and the Part D plans. So our success starts with the brand. The AARP and United Healthcare brand has had a huge influence on our market share. I would say if rates were the only factor, we wouldn't be #1 market share leader nationally. It just wouldn't be possible because we know we're not always the lowest cost plan. But we are, importantly, competitive in our rates, and we also have the value adds as well as the track record of stability since taking over the program. So if you look at these charts of the 68 million Medicare eligible population, about 22% of those individuals have a Medicare supplement plan. And then with United Healthcare having over 4.4 million members, we account for almost 1/3 of the Medicare supplement market. So that's huge. That really helps to, again, stabilize the rates. We have a large risk pool of individuals. It demonstrates our ability to service those individuals. We don't see a large fluctuation in individuals that drop their plans, for example. And we really are committed to being that long-term stable brand that you can rely on and continue to invest in our products by bringing out new strategies and products to market as well. So again, talking a little bit more about the stability of the rates, we do have a long-standing history of low rate increases. And again, this goes a long way to help consumers manage their financial needs. For 2021, our average annual rate increase was about 4.5%. So this is across all plans, all states. And then from 2015 to 2021, the rates nationally, again, the average rate was about 3.4%. We are starting to see a lot of our approvals coming in for the 2020 rate changes. And I think we're going to see actually probably an average rate increase even lower than that 4.5% this year, which I'm really excited about. And again, the average rate increase has been below 5% since 2008. So we're trying to keep them as stable as possible and always underneath that 5% cap. And this is, again, a great message to share with your customer. These plans have a stable rate history that demonstrate we don't surprise them with double-digit rate increases in the future. So this chart is just kind of a more expanded timeline of the pre-United Healthcare taking over the contract and then post-United Healthcare taking over the contract. Pre-United Healthcare, you could see it was very volatile. But again, when we took over the contract in 1998, the first thing we did was focus on that rate stability. And that's really the power of what experience can do to a program. And, you know, individual carriers, I kind of talked about this a little bit earlier, they're coming at us all the time trying to grab market share. I think the challenge there, though, is that the rates aren't sustainable because they come in with a low rate and then they can't get enough enrollments to actually stabilize their block, and therefore they're going to start to see double-digit rate increases. Now, it might not be in the first year, but, you know, second year, third year, they might have some reserves to help offset those rate increases. But again, it's not something that you want your consumer to experience, and then they might be out of, you know, opportunities to switch out of that Medicare Supplement plan. They might, you know, they're not going to qualify for open enrollment. They likely won't have Guaranty Issue, and so their only opportunity would be to go through underwriting. And depending on their conditions, they may not pass underwriting. And really, truly, we have to get our pricing right. So sometimes there's some confusion about this, but our claims are paid out from premiums collected. So we don't have additional funding from CMS to pay our claims. You know, it's not like the Medicare Advantage model. So for every dollar that comes in, we have to manage how much is spent on claims and administrative costs. So part of this is, you know, the challenge is just getting the right mix of business as well. All right, so let's talk a little bit about the plans that United Healthcare has available for Medicare Supplement. Left to right on the chart is going to be pretty much the most comprehensive to the least comprehensive plans that are available to newly eligible consumers. So most comprehensive is going to be Plan G. And then on the far right, you're going to have plans C and F. They are still, of course, available, just available to previously eligible individuals. And F was considered to be that most comprehensive or Cadillac plan. So now for newly eligible folks, they have Plan G as the most comprehensive plan. The only difference between plans F and G is going to be that Part B deductible. So an individual will have a little bit of skin in the game, and I think that was, you know, one of the intentions, of course, of MACRA is to make sure that, you know, it wasn't first dollar coverage. They wanted to have the consumers to, you know, have a little bit of money and, you know, paid out in the deductible before they started seeing their claims paid at 100%. We also offer Medicare Select plans in certain markets. So we have Medicare Select Plan G and Plan N. And members are not required to see network doctors. They can see any doctor or specialist who accepts Medicare. However, the doctor that they are seeing, you want to make sure that they have admitting privileges at a network hospital. So that is the only requirement from a network perspective with a Medicare Select plan is that they go to a network participating hospital. You'll also notice too that foreign travel is covered under plans G and N as well as F and C. So there is a limit to the foreign travel emergency care. It's limited to emergency situations while on a trip outside of the United States. The care would have had to have began within the first 60 days of the trip outside of the United States, and it would have been for services that normally would have been covered by Medicare. So if you're traveling overseas and maybe decide that you want to get a tummy tuck that would not have been covered by Medicare, that would also not be covered under the foreign travel policy. So there is a $250 deductible for foreign travel, 20% coinsurance, and then a lifetime maximum of $50,000. So that is the only service that has that lifetime maximum on there. But again, it's a great benefit to have if you're out, you're visiting a foreign country, you have a minor, maybe a cold or you're not feeling well, you stub or break a toe, you definitely would be able to, reimburse yourself for some of the expenses that are incurred for those services. But with the $50,000 lifetime max, I do always recommend, that if you are looking at traveling extensively or you're worried about your health, that you have maybe another, travel policy that has maybe a higher limit there to cover you. We do get a lot of questions, from agents, members, et cetera, about, will their plan cover their surgery? Maybe it's a cataract surgery or an EKG. And since we are the secondary insurance, as I mentioned before, a Medicare supplement plan supplements Medicare, so we pay secondary to Medicare. We're going to pay benefits for Medicare eligible services, and it's up to Medicare to determine what is covered. So a lot of times I will refer agents to Medicare.gov, and they have a section called "Is my test procedure covered?" in order to determine if it's a Medicare covered service. Or they can even call Medicare directly. I use this as an example because I think it's kind of a more unique situation, but let's just say somebody is wanting to know if acupuncture is going to be covered. So you type in acupuncture, and you're going to get the results for 3 different, things that might fall under acupuncture. And when you select acupuncture, it's going to tell you, well, it does cover up to 12 visits in 90 days, but it's only for chronic low back pain. So you have to be careful to know exactly why it would be covered, because if it's not low back pain, then it probably won't be covered by Medicare. And then even below, again, it will give you some more definitions as to, well, what is chronic low back pain? It's lasting 12 weeks or longer, not associated with surgery or pregnancy, no known cause, so idiopathic. And then you have to see certain providers that meet certain criteria. So again, it's a great tool. I think there's even an app you can download on your phone in order to see what Medicare might cover. So here's our map of the plans that we offer through the United States. As I mentioned, we have a national presence. We have our United Healthcare Insurance Company license in almost all of the states, and then we've introduced a new product under the United Healthcare Insurance Company of America entity in 5 states. So you'll see that in Texas, Ohio, North Carolina, South Carolina, as well as in North Dakota. We are planning on expanding that into new states, and the new product offering has the same great service and benefits that the existing entity has, but without the additional value-added services. So it's got a much lower price point for consumers that maybe aren't interested in the additional value-added services that come with the AARP Medicare Supplement plans. United Healthcare also offers a variety of discounts to help offset the cost of a Medicare Supplement plan. They will vary by state, but in most states we have the annual payer and EFT discount, so those two can't be used together. You either pay your entire premium in one payment, to get the $24 discount, or you can pay by electronic funds transfer and get the $2 per month per household for paying by EFT. And then we also have an early enrollment discount and a multi-insured discount. And then the good news is one of the things we've been doing over the past year is expanding the multi-insured discount from 5% to 7%. So in about 26 states, we've already recently changed to 7% over the last year. And then now this year, we have another 10 states that are being filed to increase that multi-insured discount. I'll point out that Colorado, actually, we just introduced the 5% multi-insured discount last year. And look, this year, a year later, we're already looking to increase it to 7%. So very excited there for Colorado. And then we're also adding the multi-insured discount in new states as well, so Kentucky and South Dakota. And then the 7% will be added immediately in Montana. I did mention another discount that we offer, and that's the early enrollment discount. So there are different versions depending on the state, as you can see. So we've got most popular is the 16-year early enrollment discount. And then the 16-year, they can save 39%. That 39% is level for the first 4 years, so ages 65 to 68. And then once they hit 68, it'll wear off by 3% through age 81. We also have the 12-year version, so that was previous to the 16-year version. And it's the same concept. So in the first year at age 65, they can save 36% off of their the standard premium, and then it's going to wear off each year by 3% through age 77. And then the states that are in yellow, typically the reason that they don't have an early enrollment discount is because the rating structure isn't going to support the early enrollment discount. They're either straight community rated or they're maybe entry age rated. Or they might have a modified enrollment discount like Kansas and Massachusetts. All right, so I did mention that we're always trying to bring some new products to market or looking at ways to innovate and provide value to our members. So this is a new program. It was actually started piloted last year, but now that we're here in 2022, we're going to be rolling it out to additional states. So beginning in January of 2022, Easy Claim Pay is a new service that is available to Plan G members in Colorado, Indiana, Missouri, Oregon, and South Carolina. And that's going to give them an easy way to pay their Part B deductible to their providers. So as we talked about, those newly eligible Medicare beneficiaries are no longer able to purchase a Plan C or an F that covers the Part B deductible. And one of the reasons Plan F was so popular was because members didn't have to worry about out-of-pocket costs after Medicare paid. It was truly set it and forget it. Now, with Plan G being the most comprehensive, someone that is newly eligible will still have to be able to, we still want to be able to give them that Plan F feeling at a Plan G premium. So it'll feel like a Plan F, but they're paying the Plan G premium. They're just pre-funding that Part B deductible. So members can select from two options that they would like to do to take advantage of this service. They can either fund the Part B deductible upfront from their checking or savings account, and we'll hold the funds and then disperse them when the claims come in to us, or they can have the Part B deductible claims withdrawn directly from their checking or savings account as they're incurred. So either way works. You know, it's really up to the consumer which way they would prefer to have that done. And the best, you know, really the best part of it is this is at no cost to the members. So they can set this up for free. You know, we take care of the administrative burden of paying these claims for them for the Part B deductible. Some other things that we do here at United Healthcare, which I think are very exciting, is we offer throughout the year various sales incentives. So we do have a few that are coming up on the end, unfortunately. So we're here in mid-February, but I did want to mention, you know, at least that you're aware in case you have some last-minute clients or prospects that are looking to enroll. So we have our no-limit sales incentive that's going on currently. The last effective date that we can receive on 2/28 for 3/1. So they have to be received and signed by 2/28 for a 3/1 effective date. And you can see on the screen, there's multiple states that are participating in this, and it'll apply for both Plans G and Plan N. And these are going to be for underwritten applications. With the exception of South Carolina, all applications would be included. We also have our Florida incentive that's going on. Again, the last part of this is coming up, so it goes through 2/28 for a March 1st effective date. And again, these are commission eligible, accepted, and paid sales for Plans G and N for anybody that's over 65 that resides in the state of Florida. And then last but not least, we also have our California incentive that's still going on. Not only is there an incentive going on, but we have our freedom to switch. So with freedom to switch, individuals can apply if they have a MedSup plan with another carrier and they are looking to change to an AARP Medicare supplement plan, they can do so without underwriting. So it's basically an underwriting holiday. And they can do that again through the end of February for March 1st effective dates. And then those applications, if they apply for a plan F, G, or N, would also qualify for our for our California sales incentive. So plans F, G, and N count towards the incentive. They have to be underwritten in their MedSup open enrollment, in their birthday open enrollment period that's available in California, or they qualify for the freedom to switch offer. So only Guaranty Issue would not qualify for the state incentive. So just to kind of wrap up a little bit more, you know, about why selling the AARP Medicare supplement plans. Again, you know, you have that opportunity with the built-in access to over 38 million AARP members that have an affinity for the brand. We offer plans in every state and territory, and we're always looking at ways to provide value to consumers like the Easy Claim Pay. And then we're also looking at adding new products. So we've got our United Healthcare Insurance Company of America. We're also looking at adding high deductible Plan G, as well as, and I'll let you in on a little secret, don't know the actual launch date, but we're also looking at adding a dental, vision, and hearing buy-up option as well. So our experience in the Medicare industry has really provided a proven record of long-term stability that your clients can count on. And that rate stability is also going to lead to longevity and satisfaction. Our persistency rate is at 11.5 years when enrolling at age 65, so it's longer than any other carrier. The business really sticks, and it's going to allow you to focus on new business and not be distracted with unhappy clients. And then when your clients are happy, they're going to be more apt to tell their friends and create that referral pipeline for you. So having that 9 out of 10, NPS score is really fantastic. All right, so we talked about the brand and stability and how they're, big differentiators when it comes to a Medicare supplement plan, but we can't ignore our value-added services as well as a differentiator. I do think, sometimes these programs can often be overlooked, but they are really important when making a buying decision or when looking to maybe make a plan change situation. I've actually seen members move to another carrier to save a few dollars, only to find out that they now have to pay for their gym membership, and they're actually paying now more out of pocket than they were when they had our plan. So it's always something to be aware of, when making those changes. Most of the states actually are covered and have free access to a gym membership in addition to the multitude of other discounts and services that we offer. Staying physically active is, I would definitely say, a key factor in a senior's health and well-being. And then joining a gym can also help prevent isolation, which is another problem that sometimes seniors face. So that physical and mental health benefits are undeniable. I was actually reading an article, it's been a few weeks now, but it was about individuals with Parkinson's disease and how, just a little bit of exercise each day can slow the progression of the disease and help them maintain their ability to walk as well as, their balance, of course. And that's just, one condition that could have, such an increased benefit from a little bit of exercise. You'll see most of the states that are in the dark blue, those are where the Renew Active gym membership is available, and we just added New Mexico on 1/1/2022. And then the lighter blue colors are states where silver sneakers are still available. And then we have a few states that do not have a gym membership program currently. New York is a little different because they do have Renew Active, but then they also have Staying Sharp and the Nurse Healthline, so they don't have some of the other discount programs that are available. So under both programs, when it comes to the gym membership, members would need to use a gym participating in the respective network. Renew Active by United Healthcare is going to give them access to about 20,000 plus gyms throughout the Premier Network, which is the same as the United Healthcare MA Network. It also includes local and national gyms like YMCA's, Planet Fitness, Anytime Fitness, and even Orange Theory. Renew Active also includes access to the Fitbit community, which gives workout videos of varying styles and intensity. And it's a great alternative for people that might not be comfortable going into a gym quite yet. And then Silver Sneakers also is available, like I said, in 7 states. And they have a broad network of about 15,000 gyms and unique classes that are geared towards seniors. We've got the Dentegra dental discount. So these 3 services are offerings that can be classified as discount services. And with the dental discount program, members can get an average discount of about 30 to 40% on a range of dental services like cleanings, exams, fillings, and crowns. The network of dentists is about 30,000 participating dentists. And the best part of this is because it's a discount program, there's no waiting period. You can access the list of participating dentists and check estimated savings by going to the United Healthcare website. So it's dentegra.com/UHC. I always like to mention too that even if your client has dental insurance, there are times when a service might not be covered maybe by their insurance. Maybe they hit their maximum or it's considered cosmetic. If that's the case and they can't use their actual dental insurance, then they can use the Dentegra dental discount and hopefully save a little bit of money on that procedure. For vision discounts, members can save on exams and eyewear through iMed, and then their hearing care program by Hear USA, they can get additional discounts on hearing aids and screenings by Hear USA providers. Some of our other services that are available, these are kind of like miscellaneous service offerings. So members can utilize this AARP Staying Sharp, which is our online brain health program that includes a brain health assessment. And from there, they get a customized plan that's going to focus on improving their cognitive function. We have talked about, how important physical health is as you get older, but your brain health is also just as important. And then we also have our AARP Smart Driver or driver safety. Members can take a course to help refresh their driving skills, especially learning how to, avoid distractions, especially in the new cars and with cell phones. There's a lot of things that be considered distractions. It is an online self-paced study. And the nice part is not only do you brush up on your driving skills, but a lot of the auto insurance companies, they will provide an additional discount on their auto insurance premium for taking and completing the course. And then last but not least is our nurse health line, and members can call in and speak to a registered nurse 24 hours a day, 7 days a week. They can ask about, symptoms that they're having, or maybe they just have a question about their medication. And they can also help identify community resources, that they might need, like transportation, meal delivery, or finding a local medical provider. So again, it's a very wide variety of services that are available to members. I know we're kind of coming up on the end of our session here today, so I'm going to breeze through some of the marketing and toolkit stuff, and hopefully everybody's hanging on okay, but just a few more slides left. So the two main places to get the materials that for the AARP Medicare Supplement plans are the Sales Marketing Portal and the Agent Toolkit through Jarvis. The Sales Marketing Portal is going to have things like Enrollment Kits, the Producer Handbook, and the Choosing a Medigap Policy Handbook. On the Toolkit side, that's where agents can get your lead generation campaigns, all the sales presentations, which by the way were just uploaded a few, I think last week. They were all updated and uploaded. There's fact sheets and brochures, as well as additional Authorized Offer, Level 2 Authorized Offer materials, and the MedSup Clarity Guide. And then if you want to order giveaways, we also have our e-store that's available as well. So just quickly about the enrollment kits. So the enrollment kits are going to have important information for your client. They should always be provided to a consumer prior to enrolling in one of our plans. But the main things are, it's going to have the rates, the benefit tables, things like required notices. If Medicare Select is offered, the directory will be in there, as well as the application and replacement notice. Again, that's an important form. And then in 2021, we actually added the drug list in the enrollment kit as well for individuals to look at to see, to get a better idea if the drug that they're taking might cause a rate up or denial on the application. These are a couple of the campaigns that are available in Toolkit. Like I mentioned, we have a variety of campaigns in there, and we're actually working on refreshing some of these as well as adding some new ones. I would say the freedom to choose and the competitive pricing, these two on the screen here, are some of the more popular ones that agents like to use. They are customizable, and they come in different options, like either a letter, a postcard, a flyer. You can also have versions with or without a meeting if you're having a community meeting, for example, and you can include all of your agent information there as well. These are also two other options that are available. The Let's Sit Down and Talk, and then the I'm Your Local Agent is another flyer that's very popular. You can download, again, digital copies of these for free and send to your own vendor that you might be using or working with, or you can have these customized flyers printed through the Toolkit for a cost there. Many of the campaigns are self-mailers that have, that include with or without BRCs too. This is one that I am definitely very excited about. We finally have some social media posts that are available for agents. I will say that it's limited for use on agent business website and Facebook accounts. So it can't be on your personal pages, but as long as you have a business page on Facebook, for example, you can use these social media posts. Your business page does have to be approved by UnitedHealthcare. So the first thing that you have to do is register your page with UnitedHealthcare. The form is included as an attachment in the agent website and social media guidelines that's found in Jarvis. And then once you receive confirmation from UnitedHealthcare that your registration was received and approved, you're ready to go. You can find these social media posts on the Toolkit by searching social media and then click on the MedSup Facebook post. As I mentioned, the posts are customizable, so not everybody is going to have the same exact post, which is nice. And you can choose from different themes, including brand, choice, control, new to Medicare, MedSup, and Part D, for example. And then these themes are actually going to drive the different messages to build your post and the call to action, as well as the hashtags that are available. So these are just some examples of what some of those posts would look like once they are built and approved. And then last but not least, we also have our trainings that are available. There's plenty of opportunities to keep learning about the AARP Medicare supplement plans. You can check out Learning Lab on Jarvis for more instructor-led content on things like our enrollment tool, Lean, value-added services that goes into more depth about what's available, as well as the Authorized Offer program. And Boost Your Business is kind of a newer one that helps agents that might already be familiar with the plans but just need a quick reminder about what's available for AARP Medicare Supplement. All right, so we're going to wrap up with just some quick reminders. Of course, if you are submitting an enrollment application, there's 3 ways to submit an application. Online using Lean is the most preferred. I would say it's quicker, more accurate, user-friendly. You're not going to miss questions or required documents like the replacement notice. There's no risk of using the wrong application. And right now we have about 70% of our applications we receive are through Lean, but I'd really like to get that number up to 80%. Another great reason to use Lean is to help ensure the requested effective date. So applications have to be received prior to the requested effective date. And then mailing or faxing an application isn't always going to guarantee timely receipt. So we know, in the past few years here, there's been a lot of mail delays. So, to be safe, I would always recommend using Lean, especially if it's towards the end of the month. I know, as Jason mentioned, that you have Medicare Center, which is connected to CSG, and UnitedHealthcare also has the e-app on there. So if you decide that you want to, do your rate quoting in CSG on Medicare Center and then go ahead and enroll that individual, you can do the e-app, apply now for UnitedHealthcare through there as well. We do have 4 signature options in Lean. Our latest one is security question. We would absolutely get feedback from agents that there's just too many places to sign, a lot of disclaimers. And the nice thing about security question is that it simplifies the enrollment process by combining all the signatures into just one security question. The questions are things like favorite car, first pet, mother's maiden name, very simple. Individuals do have to have an email address, but nothing is sent to the client to sign like the DocuSign option. It's only to ensure delivery of the kit. And security question, which is great, it can be used remotely or in person, just like DocuSign and just like the voice signature option. We also have real-time underwriting, which is a relatively new. We kind of started dabbling into it last year, but we continue to expand on the real-time underwriting opportunities. So we were already processing open enrollment applications where there was no additional documentation in less than a minute in Lean. And then now we're also able to process some of the fully underwritten business in less than a minute or real time through Lean as well. And what we're doing is behind the scenes, when that application is submitted, we're pulling a health profile from our vendor. And if everything looks good, we can automatically accept the enrollment and issue the plan right there. You'll see that approved button pop up. And then if for some reason the results come back and an underwriting interview needs to be completed, that's where our point of sale option kicks in. So a toll-free number will pop up for your client to call in with the goal of, again, issuing a decision at the end of the call. So this really has streamlined the process and the turnaround time when it comes to underwritten applications. I would recommend when they're calling in using the point of service that they have the list of prescriptions and specialists that they've seen in the last 2 years, because that's what the underwriting questions are mostly going to be surrounding. The call takes about 7 to 10 minutes, so it's not too long. And if they're not available to call in immediately, they can just jot down the toll-free number and their application ID and call at a time that's more convenient. And of course, if you have to submit a paper application, we know there are times where you need to do that. Just make sure that everything is completed, all the questions are completed, plan choice, all areas of the application are signed, and a replacement notice is included with the application. You've got the EFT form or a check for the first month's premium, and then the coupon book will be sent, for the remainder. And then, of course, if there's any documentation needed, because maybe it's guarantee issue and you have to submit some supporting documentation, that's also submitted at that same time. If for some reason you don't have the documentation at the time it's submitted, or maybe you submitted a Lean app, we do have our change forms that are available. The most popular one I would say is our Form 4, which is for pending applications. And so that can be used to submit any additional documentation where it's faxed or emailed into us. I will let you in on another little secret on something that we're working on, and that is going to be to incorporate the forms in Jarvis. So you don't have to print out a separate form. Everything can be filled out in Jarvis and sent away, and an upload ability to attach documentation. So it'll be a great way to streamline that process. You don't have to send things back and forth for wet signatures. You'll be able to digitally sign things. So really excited to have that implemented. I'm hoping before AEP that'll be done. Just a quick reminder too about Authorized Offer. So anybody that is the Authorized Offer, they're portfolio certified for all Medicare products, and they get access to the standard marketing materials. And then if you're Authorized to Offer Elite, that means that you are, again, portfolio certified. You've had 30 commission eligible, accepted, and paid AARP Medicare Supplement Plan applications during the calendar year, and you've completed the AARP Disrupt Aging certification course. So once you hit that 30 mark, we will send you an email that includes includes directions on how to complete the Disrupt Aging course. And then once you complete that, you are fully promoted to an A2O Elite agent. Not only do you get access to additional marketing materials, but you're also eligible for the A2O rewards. So this is just a quick snapshot of some of the awards that are available. They are earned on commission eligible, accepted, and paid apps. And in 2020, for example, we paid out over $1.3 million in rewards. So we're kind of finalizing our tally for 2021, but I already know based off of where we were at, we're definitely going to be over 1.3 million this year. Each tier is cumulative, as you can see. So you start earning an application bonus on 1 to 29 applications of $10 per app, up to over 100 at $75 per application. And then once you hit 100 apps, you'll also qualify for a free trip. So we've got 3 different levels on the trips: Sapphire, Emerald, and Diamond. And again, those emails were just going out this week. So if you earned a trip or additional rewards, congratulations. You should have received that email, and then more details to come, especially on the trip. All right, and then last but not least, Jarvis, of course, is kind of like your one-stop shop for any information. We talked about a lot of things that are located in Jarvis, like the sales material portal and the toolkit, also connection to the learning lab, so you can download your commissions information. And recently, we also added the book of business, which is available in Jarvis. So that's a great retention tool for you as an agent, having access to that book of business. And it includes things like dates of birth, policy effective dates. So if you're interested in sending out birthday mailers or maybe anniversary cards for their policy anniversary, that information is all available to you in the book of business report. And then if you do need help, of course, we have a wonderful support team with the PhD Producer Help Desk. There's 3 options. You can contact them by phone, you can email them, or my favorite is click to chat on Jarvis. So I apologize. I know I went really fast and over just by like 3 minutes here. But at the end, I just want to thank you all for, of course, taking time out of your day, learning more about the AARP Medicare supplement plans, and thank you for your dedication to the product as well. So Jason, I'll turn it back to you if you have any last minute thoughts or questions.
That was awesome. I think everybody got some great information. We do have a couple of follow-up questions, if you don't mind. We had one that said, just missed that part. Do they call everyone, or do they call everyone that have a questionable application?
Do they call? No. So there's going to be ones that, you know, when they come back and it looks like everything, you know, they can be accepted at the best available rate, those will come back immediately and you'll get the approved. I would say still about 50% of the ones that are remaining are falling under that point of service or point of sale underwriting option. So that's where the client needs to call in and do that underwriting interview, where we can ask a few clarifying questions and just ensure that everything looks good, so we can, you know, make a decision by, like I said, by the end of that call. And then there's still a few applications where we might have to get medical records from, but we're talking like less than 5% of the applications, because if you were writing business with us a few years ago, you might have experienced our underwriting and never wanted to experience it again. It was tough. We had a lot of delays because of medical records. We're relying on providers to send us that documentation. It takes a lot of time to review them, and it wasn't a great experience. And that's what really prompted this change to get more into this real-time underwriting.
Okay. We've got another one. Can you touch on the Select plans again, just briefly?
Sure. So Medicare Select plans. Oh, go ahead. Is there more?
I was going to say, just I guess the differences between a regular plan and a Select plan.
Yep. So a Medicare Select plan, the only difference, all the benefits are going to be the same. So a Medicare Select Plan G versus a standard Plan G, all the benefits are going to be the exact same. But the Medicare Select plans are typically a little bit of a lower price because there is a hospital network associated with the plan. So an individual would have to go to a participating hospital, and again, that is listed in the enrollment kit in order to receive services that are non-emergency, so something that's planned. Of course, if it's emergency, they can go to any hospital that they wish to go to. But basically, the services, so if they're not an emergency, or even if services are not available at a participating hospital, then they can go to a non-participating hospital. So there are some exceptions to that network, but again, it's that's the one requirement. And so since those contracted hospitals, they typically waive, all or a portion of the Part A and hospital deductible that's covered under their plan, that savings we pass on through to, the consumer or the member as lower premiums. So it's really the plan availability. It's going to be based off of the zip code, and as long as they live within 60 miles of a participating hospital.
Okay. Another question is a discount question. Are the discounts already in the premium amount inside the book?
So the early enrollment discount, so it depends on the state, but if we're talking about a state that has the early enrollment discount, those are already calculated in the book. So you'll see kind of the ages on the left-hand side. It'll have, the base rate or the standard rate. So if it's a state that has the 16-year creed, that's typically going to be aligned with age 81. And then those enrollment discounts are going to be calculated for all the ages under that. I will say that the multi-insured discount is not calculated in there, nor is the EFT discount or annual payer. But the nice thing is with lien, if you're using lien, that is now all calculated within lien. So there's some helper questions at the beginning of the application process to determine if they qualify for the multi-insured discount or EFT. And now you don't have to worry about doing that additional math and trying to calculate 7% off of the base rate or the standard rate to figure out how much their enrollment discount or multi-insured discount is. So, and it's even dynamic. So let's just say you say that they want to do EFT, and then you get to the end of the application and they're like, I think I'm just going to do coupon. Once you switch to coupon, it's going to take that $2 discount off of the premium. So it's great because it is dynamic like that, and it'll do those automatic calculations for you.
Awesome. And we got one more question. Looks like there's a little confusion with some of the folks on the call on the difference between OEP and, well, I think what it is what is the open enrollment period for Medicare Supplement plans versus Medicare Advantage?
So the open enrollment period for Medicare Advantage, and gosh, that's been a while, that's the 3 months prior, the month of, and the 3 months after they turn 65 is their kind of their OEP, right? But for a Medicare Supplement, their open enrollment is going to be the 6 months that they turn 65 or take their Part B. So if I turn 65 on July 17th, my original Medicare Part A and B will say effective date is July 1. So I have from July to the end of December to enroll in a Medicare Supplement plan as open enrollment. So it's almost a little bit of a longer window, yeah. And then if I, continued working, let's just say, and I didn't take out my Part B immediately, but now I'm age 70, I want to go ahead and, retire, go off my employer plan. I'm retiring at the end of the year. So let's just say my Part B effective date is going to be 1/1, then I'm going to have from 1/1 to the end of June as my 6 months.
Perfect. And I think that's all the question. And Rebecca, thank you so much for spending time with us. And we also want to thank everyone that's on this call. I hope this is really informative. Please feel free to reach out to MAS today and discuss anything. We'd love to earn your business. It's 800-480-9857. And again, thanks for your time. And Rebecca, always great.
Awesome. Thanks, everybody. Enjoy the rest of your week.
Thank you. Bye-bye.